Bismillahirrahmanirrahim. Thought of the day is Wa inna Allah Rabbi wa Rabbukum fa'budu wa haza siratum mustaqim. Verily Allah is my Lord and your Lord. So worship him, that is the right path. Assalamu alaikum. My name is Dr. Inshrah Khan. I am a PGR of Community Medicine and Public Health at King Edward Medical University, Lahore. Today the topic of my presentation is Introduction to Epidemiology, and I'll be presenting this topic under kind supervision of Professor Dr. Saira Afzal. Our learning outline today will be background and history of epidemiology, aims and usage, epidemiological approaches and basics, common terms used in epidemiology, the different levels of prevention, disease burdens, investigation of an outbreak, recent updates, and then MCQs. At the end of this presentation, the participants will be able to understand the history, background, and aims of epidemiology in public health, learn basic epidemiological approaches, terms, and commonly used formulas, identify different levels of disease prevention with relevant examples, and understand how to measure disease burden and investigate outbreaks. First of all, the background of epidemiology. Epidemiology is the basic science of preventive and social medicine. The word epidemiology is derived from epidemic, where epi means among, demos means people, and logy means study. It was defined by John M. Lass in 1988 as the study of the distribution and determinants of health-related states or events in specified population, and the application of this study for the control of health problems. By examining patterns, causes, and effects, epidemiology plays a crucial role in public health, helping guide decisions on prevention, control, and treatment of diseases within populations. Whenever we talk about epidemiology, we talk about the epidemiological triad that involves three things: the agent, the host, and the environment. History of epidemiology. Here is an overview of the evolution of epidemiology. First of all, in 400 BC, Hippocrates, known as the father of medicine, he proposed that environmental factors like air, water, and lifestyle influence disease, shifting focus from supernatural to natural causes. Then in 1854, John Snow investigated a cholera outbreak in London by mapping cases and linking them to a contaminated water pump in Broad Street. His intervention, removal of the pump handle, led to a decline in cases, marking a foundational movement in epidemiology. In 20th century, there was introduction of vaccines, identification of risk factors, and use of statistical tools help control infectious and chronic diseases, shaping modern public health strategies. Global pandemics, epidemiology has played a vital role in tracking and managing outbreaks such as 1918 flu, HIV or AIDS, SARS, and COVID-19, aiding in prevention, control, and vaccine development. This is the image of John Snow's famous cholera map showing the outbreak in London in 1854, centered around the Broad Street water pump. This is the pump, this is the Broad Street, and this was the whole area that was supplied with this water and was suffering from cholera. Aims of epidemiology. First of all, it identified disease causes and risk factors by uncovering the underlying causes and contributing factors to disease development, including environmental, genetic, and lifestyle influences. It determines the extent of disease in a population by measuring the prevalence and incidence of diseases to understand their impact on specific populations and inform public health interventions. It studies natural history and prognosis of disease. It does this by investigating the progression of the disease over time, providing insights into stages, complications, and outcomes. And then it evaluates preventive measures and treatment by assessing the effectiveness of interventions to improve health outcomes and develop evidence-based healthcare guidelines. Usage of epidemiology. In disease surveillance, by continuous monitoring of disease occurrence and trends, it enables early detection of outbreaks and inform public health responses. In policy making, it utilizes epidemiological data to inform health policies. Examples include National TB program in Pakistan that develops strategies for prevention, treatment, and control of tuberculosis, enhances awareness and accessibility of healthcare services. Then it identifies and controls epidemics. This is essential in managing public health crises. Examples include dengue in Pakistan, implementing vector control measures and community awareness programs. It controls dengue Then in COVID-19, data analysis was done to guide lockdowns, vaccination campaigns, and public health guidelines. Epidemiological approaches involves three types of epidemiology. First of all, there is descriptive and then analytic and lastly experimental. Descriptive epidemiology. It involves the analysis of the distribution of health-related states or events in specified population, focusing on who, where, and when. Its purpose is to provide a detailed description of health issues and their pattern. It identifies and generates hypotheses for further investigation. Key components include again who, where, and when. Among who we have age, gender, ethnicity, and health status. Where includes local, regional, and environmental influences, and when includes patterns over time, including incidence and prevalence. Analytical epidemiology investigates the causes and determinants of health-related events, focusing on how and why disease occurs. It identifies it identifies the relationship between exposure and health outcomes. It also tests hypotheses generated by descriptive epidemiology. Key components include how and why, how examines how exposure leads to disease, and in why we investigate factors influencing disease occurrence like lifestyle and environment. Experimental epidemiology involves the study of health outcomes through controlled experiments, primarily focusing on clinical trials to assess the effectiveness of intervention. Its purpose is to determine the causal relationships between exposure, example given treatment or intervention, and health outcomes. It provides evidence for clinical and public health decision making. Types of clinical trials are randomized controlled trials and non-randomized trials. In randomized controlled trials, as the name indicates, there is random assignment of individuals to intervention or control group, whereas in non-randomized trials, assigning to groups is based on other criteria. Key features in this type of epidemiology involves blinding and outcome measurements. Blinding involves single blinding, where only participants are unaware, or double blinding, where both participants and researchers are unaware. These are designed to reduce bias. And then outcome measures include clearly defined primary and secondary outcomes to assess the effectiveness of this intervention. Importance includes it provides robust data on safety and efficacy of new treatments or preventive measures. It forms the basis for regulatory approval and clinical guidelines. Basics of epidemiology involves population at risk. Populations at risk are specific groups with a higher likelihood of experiencing adverse health outcomes due to various risk factors. Characteristics include demographic factors like age, gender, ethnicity, and socioeconomic status. Health status, individuals with pre-existing conditions, example given with diabetes or heart disease. And then environmental exposure, populations in areas with high pollution or hazardous conditions. Contributing factors include biological factors, environmental, and behavioral factors. Biological factors include genetic predisposition and age-related vulnerabilities. Environmental factors include poor living conditions and exposure to toxins. And behavioral factors include lifestyle choices and low health literacy. Public health implications, identifying vulnerable groups that is essential for effective public health planning. Targeted interventions, tailored strategies to meet the needs of at-risk population. Example given vaccinations, education, and reducing health disparities that aims to improve health outcomes and equity in healthcare access. Common terminologies used in epidemiology. First of all, there is prevalence. It is the proportion of a population that has a specific disease at a given point in time. Formula for prevalence is number of existing cases divided by total population multiplied by 100. Incidence is the number of new cases of disease that occur in a specific population over a defined period. Formula includes number of new cases divided by total population at risk multiplied by 1000. Example includes TB in Pakistan. Suppose there are 1000 new TB cases and in a population of 1 lakh, 10 lakh. Incidence includes 10,000 divided by 10 lakh multiplied by 1000 and the result comes out to be 1 per 1000 people. This would be the incidence of TB. Endemic. Endemic is a disease regularly found among particular people or a specific area, such as malaria in sub-Saharan Africa, where it remains consistently present due to local conditions. Epidemic is a sudden increase in disease cases above what is normally expected in a specific area, like the dengue outbreak in Karachi, where factors such as climate and urbanization lead to rapid transmission. Pandemic is an epidemic that spreads across multiple countries or continents, significantly affecting global populations, such as seen with the COVID-19 pandemic that emerged in late 2019. Sporadic is occasional disease cases occurring at irregular intervals, typically isolated, such as infrequent foodborne illness cases that do not indicate an outbreak. Zoonotic are the diseases transmitted from animals to humans, often through direct contact like rabies, which can be spread by a bite from infected animals. Epizootic is an outbreak affecting many animals in a specific area at the same time, similar to human epidemics, such as sudden increase in lumpy skin disease among cattle. Enzootic is a disease consistently present in animal populations within a specific area, exhibiting stable prevalence over period, like brucellosis in certain livestock. And then exotic is a disease not commonly found in a region but may be introduced, posing public health risks such as the Zika virus entering non-tropical areas. Nosocomial infections are the infections acquired in healthcare settings such as hospitals, often due to invasive procedures or inadequate infection control, like surgical site infections. Opportunistic infections are the infections that occur more frequently in individuals with weakened immune systems, such as pneumonia in HIV or AIDS patients due to their compromised health. Iatrogenic infections are the infections resulting from medical interventions, often due to invasive procedures, highlighting the importance of infection control, such as infections after surgery. Morbidity versus mortality. Morbidity is the presence of illness or disease within a population. Its formula is number of ill individuals divided by total population multiplied by 100. Mortality is the incidence of death within a population. Mortality rate is equal to number of deaths divided by total population multiplied by 1000. Absolute risk is the actual chance of developing a disease over a specified period. Absolute risk is individuals in exposed group divided by total population. In comparison, relative risk is the comparison of the risk of a health event among one group with the risk among another group. Its formula will be risk in exposed group divided by risk in unexposed group. Odds ratio. Odds ratio measures the association between exposure and an outcome, comparing the odds of an event occurring in the exposed group to the odds in the unexposed group. Odds ratio is equal to odds of disease in exposed divided by odds of disease in unexposed. If this odds ratio comes out to be 1, there is no association between exposure and outcome. If this ratio is greater than 1, this means that there is increased odds of the outcome with exposure. Or if this is less than 1, this means decreased odds of the outcome with exposure. Levels of prevention in epidemiology. Epidemiology plays a crucial role in identifying and implementing levels of prevention to reduce disease incidence and improve public health. These are the different levels of prevention: primordial, primary, secondary, and tertiary. Primary prevention aims at preventing emergence of risk factors for disease and health conditions. Strategies include policy interventions, community development, and public awareness campaigns. Role of epidemiology in primary prevention is that it helps identify social, economic, and environmental determinants of health to design effective interventions that target the root causes of health risks and disparities. Primary prevention aims at preventing the onset of the disease. Strategies include health education and promotion, example given by smoking cessation programs, immunization by vaccination for measles or influenza, and environmental modifications, example given clean water initiative. Role of epidemiology is that it identifies risk factors and populations at risk to design effective prevention programs. Secondary prevention focuses on early detection and intervention to reduce the severity of the disease. Strategies include screening programs, example given mammograms for breast cancer, and regular health checkups to monitor high-risk individuals, like blood pressure checks. Role of epidemiology in secondary prevention is that it evaluates the effectiveness of screening tests and identifies high-risk groups for targeted intervention. Lastly, tertiary prevention that aims to reduce the impact of an already established disease by improving quality of life and reducing symptoms. Strategies include rehabilitation programs, biophysical therapy for stroke patients, or management of chronic diseases like diabetes management programs. Role of epidemiology is that it assesses health outcomes and the effectiveness of treatment protocols to improve care and reduce complications. Epidemiological studies. Uh, Epidemiological studies are divided into two types, observational studies and then experimental studies. In observational studies, we have further descriptive studies and analytical studies. Descriptive studies have two types, surveys, like cross-sectional surveys and qualitative research. And in the analytical studies, we have cross-sectional studies, case control studies, and cohort studies. Moving to the next on experimental studies, we have randomized control trials and non-randomized trial or community trials. Evidence hierarchy of epidemiological study designs. This is the diagram, a triangle that shows the weightage of evidence. As we move from the base of or to the apex of this triangle, there is increased weight of the evidence. First of all, at the base we have case reports, then case series, ecological studies, cross-sectional studies, case control, retrospective cohort, prospective cohort, randomized control trials, and moving forward we have meta-analysis, systemic reviews, meta-analysis, and then GBTs. Measurements and data interpretation. Bias. What is bias? It is the systematic error in study designs or data analysis that leads to inaccurate results or conclusions about the relationship between exposure and disease. It can arise from how participants are selected, like selection bias, or how data is measured or collected, information bias. Example, if a study on lung cancer includes only hospital patients, it may not reflect the general population. This is now selection bias. If there is inaccurate recall of past smoking habits in a case control study, this will be information bias. Confounding. A situation where the observed association between exposure and outcome is influenced by a third variable related to both. Example includes age confounds the relationship between physical activity and heart disease. Obviously, older people are less active and therefore more prone to heart disease. So age would be a confounder. Sensitivity. It is the ability of a test to correctly identify individuals who have the disease, true positives. Its formula is true positives divided by sum of true positives and false negatives. If a TB screening test has a sensitivity of 90%, it means that it detects 90% of the people who actually have TB, missing only 10%. In comparison, specificity is the ability of a test to correctly identify individuals who do not have the disease, true negatives. The formula is true negatives divided by sum of true negatives and false positives. If a COVID-19 test has a specificity of 95%, it correctly identifies 95% of the people who do not have the virus, while 5% may be wrongly classified as positive. Disease burdens in Pakistan. Tuberculosis in Pakistan. Pakistan ranks fifth among countries with highest TB burden, with over 500,000 cases reported annually. Control programs include National TB Control Program that aims to achieve 85% treatment success through directly observed treatment shortfalls (DOTS). For this, there is collaboration with WHO and global funds for diagnostic and treatment services. Burdens of non-communicable diseases include diabetes, for which Pakistan ranks third globally with over 33 million adults affected. For hypertension, about 46% of the adult population is affected by high blood pressure, often undiagnosed and untreated. Other NCDs like cardiovascular diseases and cancers are rising, contributing to 58% of the total deaths annually. Challenges include limited healthcare infrastructure and high out-of-pocket expenditure that hinders effective management. Maternal and child health in Pakistan. Childhood mortality. Under 5 mortality rate in Pakistan is 67 per 1,000 live births. Neonatal mortality accounts for over 50% of the under 5 deaths driven by infections and birth complications. Maternal mortality ratio for Pakistan is 186 per 100,000 live births. Key issues include low access to skilled birth attendants and then high rates of anemia and malnutrition among pregnant women. Government initiatives include Lady Health Worker Program that focuses on antenatal care and vaccination to improve maternal and child health outcomes. WHO's role in global disease surveillance. The World Health Organization coordinates international efforts to monitor and track diseases, ensuring rapid detection and response to health threats. Key surveillance programs include Global Outbreak Alert and Response Network, that is a network of 250 institutions responding to global health emergencies, and then International Health Regulations, that is a legal framework for countries to report and manage public health risks. WHO surveillance tools include Global Influenza Surveillance and Response System that tracks flu outbreaks and informs annual vaccine composition, and then Integrated Disease Surveillance and Response that strengthens surveillance capacity in low and middle income countries by standardizing disease reporting. Importance includes WHO's surveillance initiatives help prevent the international spread of disease, coordinate vaccine deployment, and support nations in controlling outbreaks. Investigations of an epidemic. Here is a brief overview of outbreak investigation steps with a dengue outbreak example from Pakistan. First of all, we have to prepare for fieldwork. That includes assembling a team and gather resources. Response teams formed during 2021 dengue outbreak in Lahore. Then we have to confirm the outbreak. For this, we have to ensure cases exceeds expected level. Indeed, dengue cases in Lahore exceeded the usual seasonal baseline. The next step is define and identify cases. For this, we have to set a case definition and identify affected individuals. Cases were defined by dengue symptoms and lab tests. Then descriptive epidemiology. For this, we have to analyze the outbreaks in terms of person, place, and time. Cases concentrated in urban Lahore during the rainy season. Next, development of the hypothesis. Identify possible sources of the outbreak. Stagnant water in urban areas increased mosquito breeding. The next step is to evaluate this hypothesis. For this, we have to test theories through slides or lab work. Case control studies linked mosquito exposure to infections. Next, we have to implement control measures. For this we have to introduce interventions to prevent spread. Fumigation and public education were carried out. Lastly, communicate the finding. Share results with the public and officials. Public was advised to eliminate standing water and use repellent. Moving forward to the recent updates. Forensic epidemiology bridging public health and legal investigations to address modern challenges. Forensic epidemiology has been applied to a range of issues including bioterrorism, mass casualty events, and occupational hazards to inform public health and legal responses. This review explores historical evolution, primary methodologies, and most common contemporary application of forensic epidemiology, emphasizing the contribution of forensic medicine and science to public health and safety. The review underscores the strength of forensic epidemiology, including its objective, evidence-based framework and multidisciplinary collaboration, while addressing challenges like data limitation, ethical considerations, and the complexity of demonstrating causation in legal context. By applying epidemiological principles and methods to analyze the findings from forensic investigations, forensic epidemiology not only supports the resolution of individual health-related legal disputes but also has applications at the population level for public health interventions. Emerging arboviral diseases in Pakistan, epidemiology and public health implications. Arbovirus poses significant public health challenges globally, particularly in Pakistan. Concerns have been raised by recent outbreaks of West Nile virus, chikungunya epidemics, which may lead to Zika virus outbreaks in the future. Additionally, hospital-based surveillance has detected Japanese encephalitis virus in the region. Evidence also points to the presence of additional arboviruses in healthy populations such as the Karshi virus, Tamgi virus, and Crimean Congo hemorrhagic fever virus, and severe fever with thrombocytopenia syndrome virus. This review aims to address the risk factors linked to these diseases, provide specific policy recommendations for efficient disease prevention and control, and describe the epidemiological trends of these diseases in Pakistan, while emphasizing the critical need for improved surveillance and thorough epidemiological investigations. Moving forward to the MCQs. During a disease outbreak, a researcher is focused on understanding how the illness spreads within a specific population and identify the underlying causes. Which aspect of epidemiology has this scenario illustrate? A. Laboratory testing. B. Distribution and determinants of health events. C. Clinical management of patients. D. Disease prevention strategies only. Or E. Community engagement practices.
B.
Beta. Yes, the correct answer is beta. Health Resources assesses the effectiveness of a new vaccine in reducing flu cases among elderly adults. Which key objective of epidemiology are they addressing? A. Identifying environmental risk factors. B. Determining disease prevalence. C. Study disease progression. D. Evaluating preventive measures and treatment. Or E. Monitoring hospital admissions.
D.
D.
D. Delta.
Yes, the correct answer is delta. A study tests the hypothesis that frequent consumption of sugary drinks is linked to increased obesity rates in children. But key purpose of analytical epidemiology does this exemplify. A. Determining the prevalence of obesity. B. Describing the distribution of obesity in populations. C. Identifying relationships between exposure and outcomes. D. Analyzing healthcare policies on nutrition. E. Documenting natural history of obesity.
C.
C. Charlie.
Correct answer is Charlie. Following the emergence of a novel respiratory virus in late 2019, health systems worldwide observed a rapid, unprecedented spread of cases affecting multiple continents. This widespread transmission impacting global populations represent which epidemiological concept? A. Epidemic. B. Endemic. C. Pandemic. D. Sporadic. Or E. Outbreak.
Pandemic. C.
Pandemic. C. Charlie.
This was an easy one. Yes, indeed, C is the correct answer. Charlie is the correct answer. A researcher studying livestock diseases observes that brucellosis is consistently present among cattle in a specific geographical area with stable case numbers over the years. This consistent presence of disease within an animal population is termed A. Zoonosis, B. Epizootic, C. Exotic, D. Sporadic, or E. Enzotic.
E.
D.
E.
Yes, the correct answer is Eta enzotic. A patient undergoing a routine surgery develops an infection at the surgical site 3 days post-operation, despite initially being infection-free. The healthcare team suspects the infection was acquired within the hospital environment. What is the most appropriate classification for this type of infection? A. Nosocomial infection. B. Iatrogenic infection. C. Opportunistic. D. Enzotic. Or E. Endemic.
A. Nosocomial.
Iatrogenic. Beta. B.
A.
The correct answer is alpha nosocomial because this was acquired in the hospital setting, not during the surgery. This has nothing to do with the surgery, but it was due to the hospital environment. Seventh, a 45-year-old patient with HIV or AIDS is admitted to the hospital with pneumonia, a condition frequently seen in immunocompromised individuals. Due to the weakened state of his immune system, the infection progressed rapidly. This type of infection is classified as nosocomial, B. Opportunistic, C. Iatrogenic, D. Enzotic, or E. Epizootic.
B.
B.
Beta.
B.
The correct answer is beta, opportunistic. A case control study investigates a new drug found that the odds of experiencing side effects in the exposed group, those taking the drugs were 8, while the odds in the unexposed group, those not taking the drugs, were 2. What is the odds ratio of experiencing side effects for those taking the drugs? L A2, B4, C6, D8, or E10?
Beta. B.
B. Beta. 4.
4.
Yes, the correct answer is 4 because the formula for odds ratio is we have to divide the odds of exposed divided by odds of unexposed. So 8 would be divided by 4 and answer would come out to be 4. Sorry, 8 would be divided by 2 and answer would be 4. A community health program offers free mammogram to women over 40 to detect breast cancer in its early stages. This strategy aims to reduce the disease's severity by catching it before symptoms appear. Which type of prevention does this example illustrate? A. Preventive counseling. B. Tertiary prevention. C. Quaternary prevention. D. Primary prevention. Or E. Secondary prevention.
D.
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 The correct answer is E. Secondary prevention because the disease has occurred and now we are aiming to reduce the severity of this disease. Primary prevention is when we prevent the disease. Last, a new diagnostic test for COVID-19 is introduced in a screening center. It correctly identifies 950 out of 1,000 individuals without the disease, while 50 uninfected people receive false positive results. This test is evaluated for its ability to exclude non-cases. What is this measure called? A. Incidence. B. Predictive value. C. Sensitivity. D. Specificity. Or E. Accuracy.
D.
Yes, the correct answer is delta specificity. This is the key to all MCQs. This is the link to our YouTube channel where this presentation will be uploaded. And thank you for your attention.